Welcome to Moments with Marianne. This is your host, Marianne Pastana, and we're here today with special guests, Dr. Finn Gustafsson and Nancy Rajanen, and they're here to share with us Do More for Your Heart Failure. So are you suffering from heart failure and looking for treatment options? Well, today's guest is going to dive into just that. Dr. Finn Gustafsson is the Division Vice President and Chief Medical Officer at Abbott's Heart Failure Business. Dr. Gustafsson leads a heart failure medical affairs organization, which is involved in new product development, preclinical research, emerging technologies, and clinical trial strategies. He joined Abbott in 2025 and is an internationally recognized expert in advanced heart failure. He has authored more than 400 peer-review articles. So welcome to the show, Dr. Finn Gustafsson and Nancy Rajanen.
Thank you.
Thank you very much.
What an honor it is to have the both of you here. And doctor, why don't we just dive into this? I mean, a lot of times we hear people talking about they have a weak heart or maybe they're having some heart issues. So what does heart failure really look like?
Yeah, so heart failure is a disease that affects around 7 million Americans, so very prevalent disease, very common disease. And it's either a very weak heart that can't really contract or a stiff heart that can't really get filled. What it leads to is that the heart doesn't really pump the blood out into the body organs and into the muscles. So typically the symptoms of heart failure are you get tired, you get short of breath when you exercise, like walking stairs or do the groceries, and you get a tendency to build up fluid in the body. So typically swollen ankles or swollen belly, those are the typical symptoms of heart failure.
Now, other than those symptoms, are there other things that we should watch out for, some common signs?
Yeah, I think these are by far the most common signs of heart failure, and there are other less common findings, but really truly these are the ones that you should be looking out for and making sure that you see your doctors if you experience any of these things, because heart failure is a very serious disease. There are good treatments. If you don't get the treatments, there's a very high likelihood of unfortunately dying from the disease, where about essentially 50% of patients diagnosed with heart failure die within 5 years.
So how do we track down an accurate diagnosis?
So once you report to your physician with these symptoms, typically an ultrasound of the heart will be done and some blood work. And that will inform us well how the heart is working, whether it's we have this heart failure condition. And then we will start a series of medications and considerations for other treatments as well.
So Nancy, let's hear a little bit about your story. What first prompted you to seek medical attention?
Well, I was really an unlikely candidate and one who probably assumed that I couldn't get heart failure because I was living a great healthy lifestyle. I ate well. I've never been a smoker. I've never been overweight. And so when all of a sudden I was exercising at the pool and I wasn't able to breathe, I assumed that it must have been bronchitis or something and kind of dismissed it. But when I finally did have symptoms that were really causing some significant shortness of breath, I went to the doctor, assuming that I would get something like an inhaler, but I didn't. I ended up with a diagnosis of heart failure, and then I began that series of treatments through medication and devices that have helped me identify when I'm in need of changes of medication. But more importantly, it's kept me out of the hospital.
Oh, what an important piece that is. And you mentioned devices. Can you share a little bit about that with us?
So initially I had something called an ICD implanted, which is a pacemaker and defibrillator, and it has an additional lead which helps the heart function. But additionally then I had the CardioMEMS by Abbott implanted, which is a sensor and helps my doctor monitor how the internal pressures of my heart are going on a daily basis. And that gives them really good data. They're able to then not be just operating on what my symptoms are, but it gives them very accurate reading of what's going on with my heart so that they can respond appropriately with changes of medication or suggestions for things that I might do to help alleviate the shortness of breath.
Now, doctor, can you share a little bit about that, the device itself and the information you get? How do you use that information?
Yeah, so first of all, CardioMEMS by Abbott is a small sensor that works without internal batteries. It's implanted under local anesthesia, either through a vessel, a small vein, either through the groin or the neck, and then basically sits in the lung vessel. It measures the pressure, and as Nancy describes, the patient lies down on a pillow every day. The pressure is then sent from the sensor to the pillow, and then further on through to a secure website where these pressures are read off by the heart failure nurse or the heart failure doctor 2 to 3 times a week. If the pressures are increasing, these pressures, it's a sign that the heart is stressed and that fluid will build up if no interventions are made. And it really informs the physician or the nurse that, in this case, Nancy would be needing more medications to relieve the heart. This prevents symptoms so we can treat them before they appear, and it's been proven to reduce the need for going to the hospital, and in some patients also reducing the risk of dying from heart failure.
What a great time we live in to have this type of equipment available. How would you say that this has changed your quality of life, Nancy?
Well, I consider myself first and foremost a grandma, and having the ability to play with them, to run around with them, to get down on the floor and back up again, I can do that without getting out of breath. It also allows me the comfort to be able to travel because I know that I don't have to worry about, well, what if I have a problem while I'm gone? What if I'm short of breath there? I wouldn't have to try to seek out an emergency room to get there. I know that I can take the pillow along because the sensor is always sitting in my pulmonary artery there, and so I'm able to do exactly what I want to. And believe me when I say that I live a full life, that I'm able to exercise every day, whether it's in the pool or to ride my bike, and most importantly, to spend time with my friends and grandchildren.
So, doctor, is it real important when we're starting to have any type of symptoms that we find a specialist that is really well versed in heart failure?
It is really, really important. And I think an important piece of information is that about half of patients in the US suffering from heart failure are not diagnosed. So there is it's very important to see your primary care physician, who can then refer you to a cardiologist who can do the ultrasound of the heart and blood work to learn if you indeed have heart failure and start those life-saving medications and considerations for devices like CardioMEMS.
So, how can we talk to our doctor about heart failure treatment options?
I think it's important to, first of all, make sure that you get the right medications. Those are the cornerstones of treatment, and the doctor will work with you on that subject. And then I think really inquiring about the potential for could I benefit from a device like CardioMEMS? Are there other options for me that will help me make sure I stay out of hospital? I think that is an important discussion to have with your cardiologist.
Is there anything that we can do to improve heart health and reduce the risk of hospitalization?
Absolutely. First of all, prevention of heart failure is key. So risk factors such as smoking, overweight, lack of exercise are important factors to avoid in the first place getting heart failure, but that doesn't help everybody. Certainly, there are also patients like Nancy who have lived a very healthy lifestyle and yet still develop heart failure. So what we can do is then, once heart failure is diagnosed and develop is to be take the prescribed drugs at the right time is extremely important, and then be considered for further treatment options like devices like CardioMEMS.
Well, Nancy and Dr. Gustafsson, thank you both so much for taking the time to be on the show with us here today.
Our pleasure. Thank you.
Pleasure. And if you want to know more about heart failure, if the listeners want to know more, I would direct them to domoreforheartfailure.com.
Well, thank you. Make sure to visit domoreforheartfailure.com to learn more about heart failure and steps you can take for treatment. Well, we're at the end of our time today. I'd like to thank everyone for tuning in. You've been listening to Moments with Marianne, where we make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Make sure to tune in and visit momentswithmarianne.com for more information.